Good evening and happy May the 26th to everyone. My name is Dr. Maria Sophocles, and I'm the host of Gynecology. And tonight we are going to talk, or I'm going to talk, you're going to listen, and I hope you'll ask some questions about medical abortion and what you can do to understand it, what you can do to help support other people who might need one, and why I think now more than ever, this is a super important topic. Um, I was recently in Washington, D.C., marching with thousands of other men and women of all ages, advocating for the preservation of Roe v. Wade and the um, legality of abortion nationally. I think, in light of the recent Supreme Court document that was leaked to the public, which foreshadows the overturning of Roe v. Wade, it's more important to me than ever that rather than wishing the Supreme Court justices would think differently, that women understand their options for reproductive choices, including that of pregnancy termination when necessary. I'm sure we will have on Gynecology um, a show in the near future about um, contraceptive options. And of course, that's always, always important. But in the event that an unwanted pregnancy occurs, it's imperative that women today know what their options are and how to get access to safe and effective pregnancy termination. My hope is not to increase any abortions, medical or surgical. My hope is that as abortion access decreases and becomes more challenging on a national level in a state by state basis, women will more seriously and more widely utilize safe, effective, long acting, and reversible contraception. We call these LARCs, LARCS, and probably the best known LARC is the IUD. So it's time to consider and reconsider using in a widespread fashion a contraception that's effective and reliable so that fewer women have to deal with struggling to find an abortion. But because abortion is inevitable, because accidents happen, because rape happens, because sexual assault is omnipresent, and because even the best birth control options are not perfect, abortion is inevitable. Unwanted pregnancies are inevitable. And as I speak with many of my colleagues who were already trained as OBGYNs before Roe v. Wade, their stories are particularly horrifying to me. The um, the massive numbers of women who are brought in to OBGYN operating rooms suffering from complications of septic abortions, and the vile smell of Pseudomonas infections from women who were trying to abort their pregnancies at home and did so sometimes successfully, but often with infectious complications. None of us, no clinician and no non clinician wants to see that come back. So tonight, I think it's important to me to make sure you all know the basics about medical abortion, and maybe you'll learn some interesting statistics you didn't know before tonight. A medical abortion, also known as medication abortion, occurs when medically prescribed medications are used to bring about the termination of a pregnancy. They're an alternative to surgical abortion, such as dilation and curettage, or D&C, or what we call D&E, dilation and evacuation, which is done by vacuum aspiration. Medical abortions are more common than surgical abortions in most countries in the world, including Europe, India, and China. And even in the United States, they now account for 54% of all abortions, so technically are more common than surgical abortions. They're typically performed by administering a two-drug regimen, Mifipristone and Misoprostol, nicknamed Miffy and Miso. And it's very important that these medications are taken sequentially and in the right order and at the right time. And if so, it's incredibly safe and incredibly effective. Medical abortion, make sure you understand, is not the same as emergency contraception or what many people call Plan B. Plan B involves taking medications like levonorgestrel soon after intercourse to prevent a pregnancy from beginning. But once a pregnancy is confirmed and we know it's in the uterus and the pregnancy is unplanned and undesired, then surgical or medical abortion are two options. So, medical abortion was actually first used in the United States in 1979 with a medication called carboprost. And then in 1988, it was the medication in the US was changed to Misoprostol. This first was called RU486 and was used in France, also developed and used in 1988. So we have been using Misoprostol for medical abortions for 34 years. This isn't a new technology. This is well known. This is tried and true. And we'll talk about how and where to get Misoprostol in just a minute. I think it's important to, before we go into exactly what happens in a medical abortion, to remind women and men listening that no one can tell if you've had a medical abortion or are miscarrying. It's a private thing. You can take these medications at home. And if you have a heavy period or you have nausea, vomiting, diarrhea, or some of the other side effects, and you feel you need to call your doctor or go to an emergency room, you don't have to tell them why you're bleeding heavily. You can say, this is a heavy, irregular period. Or you can say, I have a stomach bug and I'm nauseous and vomiting. No one needs to know. I feel it shouldn't be something that you have shame about, but most women do. Most women are terribly ashamed when they're terminating a pregnancy. And it keeps to a doctor or an emergency room if they are having complications from a medical abortion. And other people, it keeps them from even deciding to do the abortion or weighing their options or an inability to decide, and then they wait and wait. It's much, much better if you're sure you want to have an abortion to proceed with the abortion. And if you have complications, to seek help. If you have a medical abortion and are bleeding a lot, remember you can go to an ER and just tell them this is a very heavy period. That's all they need to know. There's no blood test that they can do that tells them that your heavy period is from a medical abortion. There is an asterisk to this. And that is if your medical abortion was done not with FDA-approved medications, but with herbal medications, because there are herbal medications that have been studied for abortion, and some of them are quite unsafe, then you should tell someone in the emergency room that you used herbal medications to try to induce an abortion, because that can be dangerous, and that emergency room physician needs to know that. So I hope that's clear. That if your medical abortion was done with herbal medications, you should tell someone in the emergency room if you're having complications, because they need to know what other side effects those herbal medications may cause. I'm hopeful that most people after this show will not really give a lot of thought to using herbal medications, because the FDA-approved ones are available and they are safe and they've been in use for so many years. So anyway, other than that, nobody in the ER or any urgent care center needs to know that your visit for a very, very, very heavy period was actually a medical abortion gone awry. Why am I deciding to be a scofflaw about this? Well, because on a state by state basis, we're seeing some really frightening things happen. We're seeing women who show up to emergency rooms stating that they tried to terminate a pregnancy on their own at home, and then they are arrested or they undergo legal prosecution, or they are shamed or publicized. There's a case in Pennsylvania where a 17-year-old girl was pregnant, and her mother helped her with a medical abortion at home. And when she started to bleed a lot, they went to their local emergency room, and the mother was charged with assisting in what they called feticide, the murder of a fetus. So we are living in a world where literally 10 miles down the road in a different state, if that's the emergency room you go to and you say you're performing a medical abortion on yourself or helping someone else, there are legal ramifications to that. And I just want women to be able to be safe and get the help they need safely. Since we live in a society where you may be negatively judged, inappropriately cared for, or even arrested or sued for performing a medical abortion. So in my mind, lying about why you are bleeding heavily may just protect you from the action, from untoward actions, and from the judgment that I don't believe you deserve. Let's talk about where you can get pills for medical abortion without an in-person visit, because things have changed in America, not just because of this impending Roe v. Wade decision change, but even as a result of the COVID pandemic. So from 2000 and what was it? 2011, I think, until December 2021, you had to go to a clinic to receive abortion pills. You had to be seen by a clinician and go to a clinic. And this all changed when the COVID pandemic made it very difficult for women to get to a clinic. So the FDA reversed their previous mandate and allowed women to get abortion pills by phone or by telemedicine without a clinic visit. They allowed, in fact, abortion medications to be dispensed by pharmacies, but only certified pharmacies. And these certified pharmacies require the pharmacy to be given special permission by the FDA to dispense the drugs. Now, the FDA only subjects 40 out of 19,000 medications managed by the FDA to this kind of stringent oversight, which I find absolutely stunning, because to me, this is saying that this is one of the 40 most dangerous drugs out there. I think not. Anyone who reviews the data on medications used for abortion knows they're incredibly safe and incredibly effective. Nonetheless, the FDA mandated that only certified pharmacies are allowed to dispense these medications. But that was a crack in the door. That was progress, because at least we now have the ability to get these medications through telemedicine or direct to consumer sites. So let's talk about some of those sites. One of them is called Plan C, and I'll put up the websites for you. Plan C is a way you can get abortion pills. Another is called Safe to Choose, Safe to Choose. Another is called Women on Web. There's one called Women Help Women. And then there's a couple of others. Hey Jane is one of them. And Carafem is one I like. Carafem, Carafem. Carafem, I think, Carafem. Anyway, you can look these up. You should look them up. You should be familiar with them, because if you or someone you know needs medication and you can't get to a clinic, or you live in a state where there are no clinics nearby, you can always search out your options on the web. I think this is super important, and I think we have to be internet strong, is what I call it. In other words, if we're going to take care of ourselves and have to advocate for ourselves. We have to know who our friends are and how they can help us. So let's talk a little bit about what are the options for a medical abortion. There's not too many. Option one is two medications, Mifipristone and Misoprostol, the meds I alluded to earlier. This is the FDA recommended option. This is the option recommended by the NAF, the National Abortion Federation, the National Abortion Federation. Let's keep that picture up there for a minute. Mifiprex or Mifipristone, the orange box, is the first medication taken. And the directions are that you should swallow one Mifipristone pill. It's 200 milligrams, and you swallow one. Usually this is done in the clinic in front of the clinician, but there are ways now you can do this at home. What is Mifipristone? Mifipristone is a medication which blocks progesterone. And progesterone is the pregnancy hormone that supports an early pregnancy. So without progesterone, the uterine lining breaks down and the embryo can't survive. So remember, the uterus makes a fluffy bed of cells in anticipation of a fertilized egg. That egg travels down the fallopian tube and embeds into the uterine lining. But once you take Mifipristone, that uterine lining will break up, disintegrate, and the pregnancy cannot continue. So that's in the orange box, Mifipristone. The white bottle is Misoprostol. Now, Misoprostol has an interesting backstory because it was originally developed for ulcers, for stomach ulcers. And there are women who call their internists and ask for a prescription for Misoprostol. The brand name is Cytotec, Cytotec. And they ask for the Misoprostol to treat their stomach ulcers. Whether they use that Misoprostol for another person or another condition is not for me to say, but I certainly have heard stories of women who needed to have a medical abortion, could not afford the clinic visit to come in, could not have access to Mifiprex, and so simply did the medical abortion at home using Misoprostol alone. So we're going to talk about how you would do that, because I'm just not so sure that as more and more states pass legislation making it harder and harder for women to access safe abortions and even contraception, women may have to get really resourceful. So option one is that you swallow Mifipristone, and 24 to 48 hours later, you don't swallow, you dissolve 4 Misoprostol tablets. See how the picture has the 4? 2 in each cheek, on the inside of each cheek. You allow them to dissolve for 30 minutes. Then you swallow the rest down with a glass of water. Misoprostol can give you GI issues, diarrhea, nausea. Some people instead put those 4 pills into the vagina, and that may decrease the GI side effects. But the classic way is 2 Misoprostol here, 2 Misoprostol there, dissolve in the inner aspect of your cheek for 30 minutes, and then swallow a glass of water, wash the rest of it down. So what happens if you take the Misoprostol early, before the 24 hours, you're just nervous and you can't wait? Well, you may decrease the effectiveness. You may decrease the ability of the medical abortion to occur completely. So you must wait 24 hours between the 1 pill in the orange box and the 4 pills in the white bottle. Whether you take it 24 to 48 hours later doesn't make a huge difference. Okay. So once you dissolve the 4 Misoprostol tablets, in the next 2 to 24 hours, you will start cramping. You will develop uterine cramping. You will expel the contents of the uterus. Okay. You may have severe cramping, worse than a menstrual period, and you almost definitely will require Tylenol and ibuprofen for that cramping. Some women even need stronger medications, but most do fine with a heating pad, Tylenol, and ibuprofen. Nausea is a fairly common side effect as well, and I often will give my patients anti-nausea medications. So, what's the success rate if you do this 1 pill, then 4 pill regimen? Well, it depends on when you do it. It's absolutely more successful if you do it in the first 10 weeks of pregnancy. So, um, the success rate is between 94 and 96%. I've seen 96.6% even. But whether it's 94 or 96%, that's incredibly effective. And if you're under 10 weeks, you actually can use um, Misoprostol alone. So again, if you can't afford to get to a clinic, can't afford the Mifipristone, and you just want to pursue medical abortion with Misoprostol, the success rate for a Misoprostol-induced abortion up to 70 days after of pregnancy, so up to 10 weeks, is 87%. So 94 to 96% if you use both medications, 87% if you only use the white pills. Still pretty good. So a little less effective, but much cheaper and easier to get. So, how does the regimen or the dose change depending on how far along you are in pregnancy? Well, it does. So, we just talked about if you're under 10 weeks pregnant. If you're 10 to 12 weeks pregnant, the success rate goes down just a little bit to use the misoprostol alone, down to 75%. Um, and you do the misoprostol 800 micrograms, again 2 and 2 in the cheek or under the tongue, but you repeat it every 3 hours until you begin to deliver the pregnancy. The complication rates on this are not clear. There's limited data on that. That's 10 to 12 weeks. If you're over 12 weeks pregnant, 12 to 24 weeks pregnant, you can use the misoprostol and it's 77% effective, but the complication rates are higher and the bleeding can be intense and severe. Up to 6% of people will need a blood transfusion, and about 2% will get an infection. So now we're talking about second trimester abortions. These are a much more dangerous situation. These are something I don't advocate that you do on your own. I think this should be done under the guidance and supervision of a clinician, and I'm well aware that the number and availability of those clinicians is rapidly diminishing. Um, Fortunately, most terminations occur in the first trimester and are accomplished very, very safely with few complications. So let's talk about exactly like a little nitty gritty about what happens in a medical abortion. So remember, you take the Mifipristone, then 24 to 48 hours later, you take the Misoprostol, and then anywhere from 2 to 24 to 48 hours later, you cramp and bleed, expel the uterine contents. About 2 weeks after you take the Mifipristone, the first pill, you get your blood drawn and you return to the clinic or call your provider to discuss the results. If you're doing this alone at home, it's going to be challenging for you to know that everything has been expelled. Um, in my world, in the medical world, we use a blood test called beta HCG. Beta HCG can be a plus minus, yes, no, pregnant or not. It can also be quantitative, 1,000, 1,500, 25,000, 40, and that tells us how far along you are. So what I have my patients do is get a beta HCG about 10 days after they take the Mifipristone. And I will ask them to repeat that blood test weekly until it is close to zero, until it's 5 or less. And that's how I confirm that the complete pregnancy has been expelled. Some clinics will use ultrasound, and sometimes we do see remnants of the pregnancy left in the uterus. This can be dangerous. This can lead to very heavy bleeding, but it also often just expels by itself over the next week or two. So if you leave remnants of a pregnancy termination in the uterus, it's not good. You can get an infection or you can bleed very heavily, but often it will simply pass on its own in the next few weeks. So If you don't have symptoms of an infection, such as a fever or tenderness of the abdomen or a foul-smelling discharge, then you can wait for those remnants to pass on their own. And if you're not bleeding heavily, same thing. You can wait for those remnants to pass on their own. Um, when should you have a surgical, a follow-up, and then when do you need to go see a clinician and probably have surgical removal of those contents? If you have blood clots that occur for 2 hours or more, passing huge blood clots, if you have a fever of 100.4 or higher, if you have nausea or vomiting, or nausea and vomiting that lasts for more than 24 hours, or diarrhea that lasts for more than 24 hours, any of these can seriously dehydrate you. If you have foul smelling vaginal discharge, if you have pregnancy symptoms, or if you are bleeding so heavily that you're soaking a pad every 30 minutes and you do that for more than 2 hours, that is dangerous bleeding, dangerous levels of bleeding, and you should seek clinical help. The other reason to call a clinician, whether it's an OBGYN or your family clinician or a family friend who's a clinician or a psychiatrist or an urgent care center, is if you are experiencing extreme depression or suicidal thoughts. Now, this might seem super extreme, but I think anyone who's ever thought they were pregnant or had an unplanned an undesired pregnancy or had an abortion knows what I'm talking about. There is enormous shame, grief, grieving, um, and emotional turmoil that accompanies an unwanted and unplanned pregnancy. And it's not uncommon for women to really experience a profoundly, deeply depressed thoughts or even suicidal thoughts, especially if they feel there's no way out of it or they feel bad about themselves for having the abortion. So, if you're experiencing behavioral health issues such as extreme depression or suicidal thoughts, or you know someone who is, it's totally appropriate to call a doctor about that. If you feel comfortable that this is confidential and that there's no judgment, you can share why you're feeling that. If not, you just have to say, I'm extremely down or depressed and I'm considering harming myself or others. That's all you need to say. And any clinician worth their salt will take action and help you. Okay. That's one of those not often talked about side effects of dealing with unplanned or unwanted pregnancies. I think it's also important that we talk about whether a medical abortion can be reversed. This sounds like a strange thing, but there's so much um, fluctuation in the thinking of women deciding whether or not to terminate a pregnancy sometimes, that some women will take the Mifipristone, the one pill, and then in the 24 to 48 hours before they take the Misoprostol, they'll change their mind, or a friend will change their mind, or a family member will urge them to reconsider, or a priest, or a website they visit. If a woman has taken Mifipristone, she cannot reverse what the Mifipristone has done. So if your question is, can I reverse a medical abortion? The answer is no, you cannot. And data have looked at that. People have looked at trying to just take the Mifipristone and see if the pregnancy will survive, and it rarely does. So, for all intents and purposes, you should consider that medical abortions cannot be reversed. And so, again, you should be very, very clear and firm about your decision to begin a medical abortion or not. What are some of the symptoms you might expect with a medical abortion? I alluded to them before, but I'll go through them again. Dizziness, intense cramping, nausea, potentially with vomiting, diarrhea, abdominal pain in addition to cramping, even a mild fever or chills. A mild fever of 99, even 100 is okay. 100.4 or above, especially 101 and above, is something to be taken seriously. And a clinician should be alerted if your temperature is over 100.4, especially if it's over 101. Some patients will even lactate mildly. Um, and again, we reviewed when you should call the clinic. Bleeding so heavy that you soak a pad an hour for more than 2 hours, or a pad every 30 minutes for more than 2 hours, or you pass large clots for more than 2 hours. Over 24 hours of nausea, vomiting, or diarrhea, foul smelling discharge or pus from the vagina, and excessive depression or suicidal thoughts. Okay, next question you may have. What can I do? What can I do to help people or to help myself or my friends and family? Suppose you have friends in states that are really aggressively becoming anti-abortion. And remember, anti-abortion is not the same as pro-choice. I mean, it's not the opposite of pro-choice. I have some news today, just today, that no, sorry, yesterday, May 25th, the state of South Carolina passed a law that will allow pharmacists to dispense contraceptives, which will help women who can't get contraception because they can't afford bus fare, cab fare, get it more easily. So it's interesting because the governor, in a statement, said that the reason he thought it was important to pass this legislation was not to help women get more contraception, but to help reduce the number of abortions in his state. And I don't have any problem with that. Again, I'm not pro abortion per se. I simply want to have the abortions that are done be safe. Um, this is a law, by the way, that's up for adoption in my state, the state of New Jersey. I've testified twice now to try to get this law passed in the Senate in New Jersey, once 3 years ago, and again just a few weeks ago. And I certainly hope that New Jersey will become one of the 16 states that now will have a law that allows pharmacists to prescribe birth control pills without a doctor's visit. Why, as a doctor, do I think this is okay? Because many doctors have said to me, this is not okay. Nobody should get birth control without seeing a doctor. Well, I, for one, don't believe that. I believe that if there are so few contraindications to being on the birth control pill, there are so few women for whom the pill is unsafe, that if a pharmacist has a simple checklist of those rare and um, uncommon reasons why women shouldn't be on the pill, and a woman has to sign off on that and she doesn't have any of those conditions, then a pill should be extremely easily accessible, and it should be able to be renewed year after year. Almost all women live walking or driving distance to a pharmacy, but far fewer women have access to clinicians who can prescribe birth control pills. So I feel really strongly that physicians should not be what stands in the way of a woman getting access to birth control pills. Anyway, sidebar. What can I do? What can you do to help people who need um, access to contraception or safe abortions? Number one, you can write to your local congressman or senator. All politicians know it's their constituents who keep them in office, so let yours know where you stand. End of story. If you're not sure who your local congressman is or your politician, it's as fast as Googling. We Google, Justin Bieber's latest, love story. We Google about Amber Heard and Johnny Depp. Write to your local congressman, find your local congressman. You should know who that is anyway for other reasons, but it's not hard to write to them. They all have websites. They are easy to write to, and believe me, your note, your text, your email counts. It really does. You know why? Not so much because they care about abortion or birth control. They care about staying in office. And if they know this matters to you and they know you wrote to them, then they know you're going to vote. And they know that you're going to vote for them if they do the things that make you happy. Okay, so that's an obvious one. Number two, get a Misoprostol prescription from your doctor. You can. You can always say you want it for stomach ulcers, which, remember, was the original reason Misoprostol was made. Is this dangerous? Are you playing with fire? I don't think so. I think it's really important that you get it and that you use it for yourself or for someone who needs it when you need it, if you need it. If you can't get what you need, then you'll have it. So why am I being so casual about misoprostol? Well, by the way, it's available over the counter in many, many countries globally already. I was just in a little remote island in Mexico where they didn't even have paved roads. And I went into a pharmacy, and sure enough, there was misoprostol. And this is a Catholic country where you would think they would have issues with abortion. Not at all. They have misoprostol there, and women use it, and they use it to have agency over their reproductive health. So I think it's a matter of time before misoprostol will be over the counter in this country. I hope it will be, but in the meantime, get a misoprostol prescription from your doctor. Number 3, foster open discussion about this basic human right. What human right am I talking about? A right to control our own reproductive health. So I don't think whether you're in a blue state or a red state, or your uncle's Republican and your aunt's a Democrat, I don't think any of that has to come into play. I think you can simply, if you feel like I do, look at this as a healthcare um, topic. And when I was marching in Washington, many, many of the posters just said abortion is healthcare. And so I think of medical abortion as using medications to enact healthcare. Um, Number 4, kind of the point of this whole spiel tonight, make sure that everyone you know knows what medical abortion is. If you feel awkward or uncomfortable using the A word, then just call it a very early termination or a pregnancy interruption. That's often how we talk about it because, yeah, abortion has a lot of weight to that word. And stigma and shame. So if you need to talk about pregnancy interruption, then call it that. But make sure people you know are comfortable talking about it and know that it doesn't have to involve surgery or the risks of surgery or anesthesia, which, by the way, are also really, really low. A surgical abortion done in the first trimester has incredibly low risk of bleeding, infection, or anesthesia complications. This is not a 10-hour open heart surgery. This is a 15-minute procedure with no blood loss other than the expulsion of the contents of the uterus. The hardest part is probably getting an IV started, which hurts a little, and that's absolutely the hardest part. So make sure everyone you know knows that there are medical and surgical abortions and knows that um, what the medical abortion is and how it's done. Hopefully share the knowledge you just gained from this live stream. So I think that's kind of the basic stuff I wanted to talk about. I wanted to also, oh gosh, I had meant to talk about, let's see, one sec. The countries, but I think I kind of mentioned that in passing. The fact that I just found this fascinating that in Italy, only 17% of abortions are medical abortions. In Spain, 19%. Belgium and the Netherlands, 22%. Germany, 23%. Kind of surprised. I would think Belgium, Netherlands, Germany would be so right up there along with all the Scandinavian countries. The US, 54%. So we're getting there, but we are by no means really educated or informed or utilizing this super important option. England and Wales, ahead of us, guys. The motherland ahead of us, 62%. France, 64%. Iceland, 67%. Now we kick into Scandinavia and you'll see things it gets better used. Denmark, 70%. Portugal, come on, Portugal, 71%. Switzerland, 72%. Scotland, 83%. Norway, Sweden, and Finland, again, they're not just awesome at cross-country skiing, they also really, really understand the importance of utilizing this simple and safe health benefit. 87, 92, and 96% of all abortions are medical abortions in Finland. So I bring that up just because it's the same darn thing. It's the same darn pills used the world over. Why is it used so much in some countries and not in others? I think it's simply access. I think it's an openness in society, a willingness to accept that this happens and that women have a right to control their pregnancy desires, um, and probably cost. Ooh, we didn't talk about the cost. The cost for a medical abortion and the cost for a surgical abortion in the United States are almost identical. A medical abortion on average costs $490. A surgical abortion on average in the US costs $470. So basically the same. Um, I've seen clinics charge anywhere from $300 to $2,400. And obviously that depends on where you are in the country. But on average, it's under $500. Now, we know that because there's so much shame and stigma associated with this, that many women are going to pay for this out of pocket. And in fact, 57% of all medical abortions are paid for out of pocket, not related to insurance or insurance coverage. Um, and, I guess that's fine. Neither here nor there, except that I would love to live in a country where there was really, really good coverage for this, where all women would know if they wanted a medical abortion, this could happen and this could be paid for. So at least we can remove the financial sting from this already emotionally painful process. So that was the other thing I meant to talk about was the cost. Um, anyway, I don't see anybody having any questions tonight, and I think that that's okay. I hope you'll pass this along. I hope you'll forward this to friends. I've tried to keep it short-ish. We've been on for 41 minutes, but I hope you've learned a lot. I think it's critically important that you pass this on. So spread the word, forward it, post it, or just share it. If you have any questions or you want to contact me or any of the providers in my practice, we're at Women's Healthcare of Princeton in Princeton, New Jersey. Our website is princetongyn.com. And my name is Dr. Maria Sophocles. This is Gynecology. Next week, it begins Pride Month. So Pride Month is in June, and we're going to talk to a wonderful, wonderful transgender surgeon named Dr. Susan Nazarian from Thomas Jefferson University, and she is going to bring along one of her wonderful patients, and we'll talk a little bit about the trials and tribulations of transgender surgery and transitioning, and just stay tuned because we have so many cool topics to cover this summer and the rest of the year. And I really, really appreciate all the feedback I get. Thank you so much for all the cool comments you guys send. You can email me at info@princetongyn.com, or find me through the web. Anyway, this is Dr. Maria Sophocles, and I look forward to the next Gynecology next Thursday at 7 p.m. Eastern Standard Time. Thanks so much. Be safe and advocate for each other. Take care. Bye-bye.